Let's talk about postpartum tubal ligation or postpartum sterilization. A postpartum tubal ligation is typically done within a few hours of delivering vaginally or either by VBAC, vaginal birth after cesarean, or it can be done at the time of a cesarean section. I'm going to talk about the postpartum tubal ligation done after a vaginal delivery or VBAC. After delivery, the fundus of the uterus or the top of the uterus is typically right around the belly button or umbilicus. So an incision can be done right underneath the belly button, a small one, in order to access the tubes that are off to the sides, as you can see here. And then this is where this is the area on the fallopian tubes that we are aiming to get to ligate. After we make a small incision under the belly button, we then carry the incision down to the fascia, then through the rectus muscles and the peritoneum in order to gain access or entry into the abdomen. We use these retractors to help expose so that we can see the top of the uterus and the fallopian tubes. Now, a lot of us, including me, will use position changes on the table to help rotate the patient a little bit to make getting access to those tubes a little bit easier. We then identify the fallopian tube on either side and use something called a Babcock clamp to grasp that fallopian tube. We then follow it down to the end where the fimbriae are to make sure we're in the right place before we ligate or tie that tube. Once we're in the right spot on the fallopian tube, we use two different sutures to tie two different knots on the fallopian tube with the Babcock clamp still in place. We then cut the loop or the knuckle of the tube off so that the tube is officially ligated. And that portion of the tube that we actually remove is sent to pathology to confirm that the tube was indeed ligated. And this isn't the best picture, but that is a picture of what the fallopian tube looks like after we cut off the knuckle of the tube. And I'm going to show you another picture here in a second. Now this diagram just shows what we're doing a little bit better. So pretend that's a Babcock clamp. We pull it up through that little incision. So now we can see the portion of the fallopian tube. We use two sutures to tie two different knots where we end up with a little knuckle of fallopian tube. We then cut across that knuckle so that you end up with two ends that are side by side that are tied right here together. Over time, as those sutures dissolve, the tube falls away like this so that there is a space between the tubes, so you indeed lose a portion of that tube, and that is considered permanent sterilization. Few important points to remember. Number one, it is done shortly after delivery, so you have it done before you even go home. Small incision under the belly button. The anesthesia is going to be either the epidural that you had during labor, or if you didn't have an epidural, they can do a spinal, or they can do general anesthesia if absolutely necessary. It does not cause an increase in your hospital stay. And again, this procedure is considered permanent. Finally, if you have Medicaid and you want to have this procedure done, make sure you let your provider know so that you can sign the consent forms that are required in order to get it done.